Now, let's welcome Dr. Andy Smith of Novant Health Surgical Associates. Dr. Smith, welcome back.
Hey, June, it's good to see you again.
Great to see you. Many of our viewers, or most of our viewers, know you by now, but it's always nice to remind them of who you are and where you went to school and a little bit about your background.
Oh, sure. Well, I grew up in East Tennessee. I went to college, undergraduate at the University of Tennessee in Knoxville, medical school at the University of Tennessee, which is the medical school campus is in Memphis, Tennessee.
Right.
So 4 years there, and then did my training in Wilmington through the University of North Carolina, and ended up back here.
It's sort of a circuitous route, but we're glad to have you. So tell me a little bit about Novant Health Surgical Associates.
Sure. I joined the practice almost 4 years ago this coming summer. There's 5 of us practitioners in the group, 5 general surgeons, Doctors Tillotson, DeSandre, Scallion, and Beninati, and myself.
Well, speaking of Dr. Beninati, we had him on a few shows back, and he talked about the new Da Vinci robot at Novant Health Brunswick Medical Center. And so I wanted to hear your view on the benefits of the new Da Vinci robot.
Sure. Currently there's 2 of us in the general surgery group who are using the robot
robotically trained
for procedures that are robotically trained, right? And there is additional training that goes along with that. Dr. Beninati and myself, and of course he's doing a lot of similar operations to what I do. He also does a lot of foregut, which means anti-reflux surgeries, hiatal hernia repairs, and things like that. That is really his area of particular expertise. For me, I do a lot of hernia repairs and colon surgery with the robot.
He happened to operate on a good friend of mine, and with using the robot, and she did amazing. The recovery was so simple for her, and I just can't say enough about that. So what type of procedures do you offer? Let's talk about the kinds of procedures that you offer.
So when you think about the robot, I think it's important to really outline why do we use the robot? Why is it better than open surgery or laparoscopic surgery?
Right.
So the benefits of the robot are smaller incisions, faster healing time, less pain, less hospitalization, or shorter hospitalization stay. In general, when we think about the robot, you think about places that are hard to get to with your hands, right, or even laparoscopically. So places low in the pelvis, places up under the diaphragm, and then you think of ways to save incisions and make incisions smaller and less numerous when you're doing an operation, and that falls into the hernia repairs and colon surgeries. Some of the other benefits there are less risk of infection with robotic surgery, less risk of blood loss, and in some situations with certain procedures, better outcomes overall. So the robot is here to stay, and it's really become a staple of general surgery.
How do you, when you talk to a patient about having robotic surgery, is there a language that you use? I mean, even when they see that robot and you're sitting over there, how does that, how do people take that?
So a common question is, are you really doing the operation, or is the robot doing the operation?
I didn't want to say that.
I think the best way to describe it, the robot is essentially a computerized device that assists the surgeon. So the surgeon is doing the operation. The surgeon is in the room. The surgeon is right beside the patient. We simply are using the robot to create an enhanced amount of visualization, dexterity, and precision that we're unable to accomplish with laparoscopic procedures alone.
I'm curious. It sounds like a great tool, and it works really well. Are there times when it's really not the best way to go? The old-fashioned way is better?
Sure, absolutely. Emergency situations oftentimes are not a good choice for the robot. Some of them are, but every surgeon's going to have to look at each procedure, each situation, and make that decision. We all have our understanding of when the robot's a good choice and when it's not a good choice. And it's a conversation we're going to have with the patient every time. That's something we discuss. You ask about that. We do discuss, here's why I want to use the robot. Here's why I think it's a good option for you for this particular situation. What we've found is that most patients are very receptive to the robot and very appreciative of the robot when it's involved in their care.
As I said, I did witness some of those benefits that you spoke about with this friend of mine, and she's just crazy about it. She thought that was the best thing because she had had surgeries in the past, and the recovery just was difficult. And this was
Sure.
This was much better.
Yeah, particularly I think one thing I'm seeing is, as I said, colon surgery, so colon resections, whether it's for diverticulitis or for colon cancers and things like that, and hernia repairs. My patients in general do extremely well, have less pain, faster recovery, fewer incisions, and lower risk of some of those things like we talked about, infection and blood loss. So it's a great tool, and I think it's here to stay.
Well, I understand that there is a new robot in town, right?
That's right. It's been here for a few months now. Quite an expensive piece of equipment, but we're really happy to have it.
And brand new,
And
right?
brand new. It is literally the cutting edge, top of the line. It's called the Vinci Xi robotic platform. It's phenomenal. It does a lot of things that the previous generation robot, which we had before, and most hospitals still have, did not do. So it's really just taken that ability to do things robotically, which was already enhanced, and elevated it even further. So just the way that this robot, the additional options that it provides to us when we're in the operating room is phenomenal.
That sounds awesome. I'm just so happy for you and for the hospital. I think that's a great thing for our patients.
Yeah, I think for the patients of Brunswick County,
Yeah,
it
amazing.
provides top level, cutting edge care right here at Novant Health in Brunswick County.
Right. Are you taking new patients?
We are taking new patients all the time.
All the time.
All the time.
That's great. Well, it was a pleasure having you back on the show, and I look forward to you coming back again and telling us all the new stuff that's going on.
Absolutely. We'll see you next time, June.
All right, great. Thanks.